Hello, everyone, and welcome to today's virtual policy forum, Promoting Digital Equity. I'm Cecilia Oregón, the Executive Director of Kaiser Permanente's Institute for Health Policy, and I'm glad to have you here today for our conversation. For those of you who are less familiar with the Institute, we host events and publish information to shape policy and practice on important health policy topics. We convene experts to share knowledge, spark discourse, advance collective thinking, and explore opportunities to promote more accessible, high-quality care and to cultivate healthy communities. Today's conversation touches on both promoting better healthcare and healthy communities through digital equity. Our friends at the National Digital Inclusion Alliance define digital equity as a condition in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. Digital equity is necessary for civic and cultural participation, employment, lifelong learning, and access to essential services. A little over a year ago, the Institute hosted a forum on the future of telehealth, and it was clear from that conversation and from many others that telehealth is here to stay. But the time really is now to continue to shape the digital health future. And as we've seen during the pandemic, telehealth, which includes video and phone visits with clinicians, is making it easier for people to access care from home or on the road. Other digital healthcare technologies are also available and still more are being developed, and this is shaping the future of healthcare delivery. In addition to supporting accessible, high-quality care, digital equity also supports healthy communities. Even beyond healthcare, digital access is changing the way we live our day-to-day lives. Some people have referenced digital access as a super social determinant of health. Increasingly, children need digital access to do schoolwork, adults are using it for employment, and many of us are using digital access to socialize with friends and family, access news, read books, and get information on community events and resources. When we improve digital equity, we're addressing all of these factors too. If we take advantage of the current moment of digital innovation and expansion, we can use technology to advance our broader goals of health equity. We can leverage digital technologies to expand access to care for communities that have been underserved, and we can ensure that communities reap the full benefits of digital access. With that said, though, if we're not thoughtful about digital equity, we could end up leaving some communities further behind, both technologically and economically. We risk inadvertently worsening health equity. That's why our conversation today will focus on what we need to be doing to build digital equity into programs and policies today to create a more equitable digital future. After some introductory remarks from our speakers, we'll turn to questions from the audience, and we did receive quite a few. We'll pull from the questions that many of you submitted during the registration process, but you can also ask a question by using the Ask a Question box on your screen. If at any point you have technical difficulties, please go ahead and submit a question through the Ask a Question box as well, and people are standing by to review those comments and to lend support. So now let's turn to our first speaker. Dr. Ed Lee is Executive Vice President and Chief Information Officer for the Permanente Federation. He joined the Permanente Medical Group as an internist at Kaiser Permanente, South Sacramento. He began leading the technology group in 2012, and he took the role of medical director in 2016. He has a medical degree from Tufts University, where he also received his master's in public health, and he completed his residency training at the University of California, Davis. Dr. Lee, thank you for kicking off our conversation today.
Cece, thank you so much. Thank you for having me. It's a pleasure to be here to talk about such an important topic. Next slide, please. I just wanted to start with a quick introduction to Kaiser Permanente for those who are not as familiar with us. We are an integrated healthcare system located in 8 states across the country and in DC, with a focus on providing Permanente medicine that is patient-centered, evidence-based, and culture responsive. We have over 23,000 physicians, 65,000 nurses, nearly 40 hospitals, and serve over 12.5 million members. Our core mission is to provide high-quality, affordable care to improve the health of our members and the communities we serve. And that means equal access to care, including telehealth, to everyone, regardless of who they are, what zip code they live in, how old they are, what language they speak. So that's a very pertinent topic for today. Next slide, please. I first wanted to make sure that we're all grounded in terms of what telehealth is. And Cece, you mentioned earlier in terms of telehealth, including telephone and video, but a lot of people think of video visits as being what telehealth is, and they're not wrong, but telehealth is much, much more than just video visits. I'm not going to go into detail about all these different channels over here, but let me just touch on a few. Secure messaging, I'll start with that. We've been doing a ton of that in Kaiser Permanente even before the pandemic, probably more than any other health system out there. And like others, we saw the volume of messages go up significantly during the pandemic. Those high levels have persisted over time, even as the pandemic has gone on. And I think it's because it provides patients with a convenient and effective way of interacting with their doctor and other members of the care team. Excuse me. E-visits. E-visits allows patients to go online, get advice about common health concerns. A patient answers a small number of questions about their condition, and depending on the situation, they can get rapid advice, get a test ordered, or get a prescription sent to a pharmacy. We're doing more and more of that as we build more and more conditions that are amenable to this type of technology. Remote patient monitoring provides a window into our patients' health when they're carrying out their normal lives outside of the four walls of our hospital and our medical office buildings. Patients are connected to our care teams through Bluetooth-enabled devices such as glucose or blood pressure monitoring devices. We're doing more and more of this as well, and we're seeing care quality benefits from this. And so, for example, those participating in our remote cardiac rehab program are less likely to be subsequently hospitalized. And then, the last two I'll mention, audio and telephone, audio-only telephone visits and video visits. And, people may not think of telephone visit as being telehealth, but it certainly is. It's one of the best ways for our patients to access our telehealth services, since all that is required is a phone. No computer, no laptop, no tablet, not even a smartphone is necessary. And so we have done tens of millions of these visits each year, and a tremendous amount of care is provided through this channel. Next slide, please. And so with respect to video visits, I wanted to talk about video visits by sharing a true story about a patient that received care through video technology. So here's the timeline of events here. A primary care physician had a video appointment with the patient at 8:30. There was that patient, obviously in pain, and then 10 o'clock, 11 o'clock, and then 4 o'clock. So, the entire system was really needed to coordinate this care, but the video visit was what actually started the patient's journey towards his path towards recovery here. So really a nice example of how video care can complement what we do in the in-person setting as well. Next slide, please. So this graph here, it's specific to Kaiser Permanente because it shows a kind of a high baseline level of telehealth. For the past decade, we've seen sort of a slow rise over this period of time. And in 2020, where the rest of the healthcare industry also pivoted to from a mostly in-person world to a mostly telehealth world almost overnight as a result of the pandemic. And so you see that sharp increase. If you follow this graph to 2021 and 2022, we see that rates of combined telehealth usage has come down. There's more in-person care happening as patients need to come in for sort of that deferred care that didn't occur during the pandemic. And particularly for video visits, that's gone down, although not as much for telephone visits. Other channels like secure messaging, like I mentioned earlier, remain high. E-visit usage has actually doubled in our organization over the past year. And what this goes to show, though, is that the pandemic, it's changed the way that we deliver care, including more and more digital channels and more engagement than ever before. And so I don't think anyone really believes that we're going to go back to what we saw pre-pandemic. where this eventually settles out, I think will be dependent on a number of factors, including, what happens with the public health emergency exceptions and whether or not those exceptions are going to be made permanent. And I think we'll be getting to more of that as the discussion goes on. Next slide, please. So when it comes to digital equity within Kaiser Permanente, here's our goal, which is to work on ensuring every patient has a seamless connection to affordable and reliable digital resources, has the skills and knowledge on how to use those digital resources, and then has the confidence in the safety and effectiveness of the digital health systems that they're encountering. And so if there are issues with any of these along the way, gaps are formed, challenges occur, and the full benefits of our digital care systems just won't be realized. Next slide, please. Part of our approach is to have a deeper level of understanding about what's happening now, what's happening in our current state, and that would give us insight in terms of the barriers that we need to overcome. And so here are just a few examples of articles published by our research arms of our organization, looking at patient characteristics for who and who aren't using and engaging with our telehealth. Next slide, please. So we've developed a system that has three parts: adopt, use, and inform. So adopt is about providing patients access to resources that will help them begin taking advantage of the different digital tools and services that we have. And that includes access to internet, to various devices, and learning the skills needed to navigate what we have in a digital world. Use is about helping our patients, once they have started their journey here in terms of digital engagements, to ensure they understand how to engage our digital systems, that they get any issues they have in terms of engagement resolved, and so that they can receive that high quality care delivered through the digital methods. And then inform is a third aspect here, which is more internally facing and includes how we organize ourselves to reduce digital inequities. And this can include things like research that I just mentioned, analytics, developing policy strategies, and all of those can inform the decisions that we make on how we contribute to the collective understanding and the efforts across the healthcare industry. So this really is a journey, a lot of exciting work going on within KP, and this is laying the groundwork to the future of how we will address digital equity in the future. So next slide. Oh, that's it for my section here. Thanks so much.
Great. Thank you, Dr. Lee, for that overview. Now let's turn to Amy Huffman. Digital access can be used to access health services, but it's important, as we said, for a lot of other reasons as well. So we're glad that Amy Huffman is able to join us today from the National Digital Inclusion Alliance, where she serves as policy director. Amy's work at the Alliance focuses on closing the digital divide and ensuring all Americans can thrive in a 21st century digital world. Prior to joining the Digital Inclusion Alliance, she served as the state of North Carolina's first digital inclusion and policy manager for the Broadband Infrastructure Office, which is a division of the Department of Information Technology. In addition, for several years, she was a freelance writer and consultant focused on North Carolina's startup ecosystem. Amy holds a master's degree in public administration from UNC Chapel Hill. So Amy, thanks for joining us today.
Thank you, Cece, and thank you for having me here. I really want to thank the Kaiser Permanente team for having me and for getting to be part of this really, really esteemed panel. Y'all are in for a treat. I've been on a panel before with Mei, and I've learned a lot. I look forward to learning more from her in a moment. And I was scribbling notes from Dr. Lee, and look forward to also hearing from Dr. Rodriguez. So next slide, please. So just a little bit about us in case you don't know who we are. So we are the National Digital Inclusion Alliance. We got started about 8 years ago to represent the boots on the ground, the folks across the country doing the digital inclusion work, helping people get connected to the internet by means of finding an affordable internet program or getting a device, right? So many folks across the country don't have a computer, or learning digital skills so that they can navigate the internet and their computer. So these are the organizations across the country who offer these services are our affiliates. And so we today have over 1,000 of them across the country in 48 states, DC, 2 territories, and 12 tribal entities. And we take next slide, please. We take what we learn from our affiliates and we take those needs to policymakers. So we were very involved in, for instance, in the Digital Equity Act and building that policy last year. So we'll talk more about that in a moment. We also take what we learn from our affiliates and create best practices and resources and toolkits and guides for more people to get started in this work. It's a relatively new field, so there's still lots of things to know. And then also, we do run around the country talking about this issue and bringing awareness to the topic. And we also have some data and research that we've conducted over the years, particularly around digital redlining, digital discrimination, and those sorts of things. Next slide, please. So, but before we get really started and dive into the topic, we always like to ground ourselves in definitions. And thank you to Ceci for highlighting and uplifting these definitions, which now, by the way, are codified in the Infrastructure Investment and Jobs Act. But digital equity is essentially our goal, right? It's where we want to get. We want to make sure that everyone has everything they need to fully participate meaningfully in our society, democracy, and an economy. And then if digital equity is our goal, then digital inclusion is how we get there. It's the programs, it's the policies, it's the tools that make sure we have affordable home broadband, that we have appropriate devices, that we have digital skills and digital literacy support across the country and tech support, and then making sure that the applications are usable by everyone. Next slide, please. And it's really important when we think about digital equity that we aren't saying digital equality, we're saying digital equity. So in digital equity, this means that in some places we may have to invest more funds to reach equity, right? As you can see here on this slide. Next slide, please. So over the years, we do know that there are a couple of things that are really necessary to solve this digital divide, as we'll talk about. So affordable broadband. It's if you have fiber to your home, but you can't afford it, it's useless, right? And if you have a device, or if you do not have a device, you're unlikely to subscribe to the internet, right? And devices need to be affordable and useful for you in your daily life. And then finally, digital literacy or digital skills trainings and opportunities to go through different levels, as Dr. Lee was talking about. It's a progressive, pathway that we're trying to get people on, right? We're not just teaching people to type and leading them there. We're teaching them, we'd like to teach people to type and then get them all the way that they're able to communicate with their doctors or code or do all these other things to meaningfully engage in our society. Next slide, please. And so over the past few years, there have been a number of different federal policies that have passed to both increase broadband access throughout our country. And most of this is in response to the pandemic and the realization that that there's not enough access out there. Those of us in the field who've been crying about this for years were both saddened when the pandemic happened for multiple reasons, but also because we knew that people would not be able to meaningfully engage online. But also, this has been a silver lining of the pandemic, that there's finally funds to actually address these issues. And so through the Consolidated Appropriations Act, the American Rescue Plan Act, even the CARES Act, there were multiple programs established by Congress to address the digital divide. But the big one that we'd like to talk about, or I'd like to spend the bulk of my time on, is the Infrastructure Investment and Jobs Act, which we know actually wasn't in response to COVID, but it contains $65 billion for broadband and is deployed through a number of different programs that we believe could set our nation up for really creating systems and that will set us up to close future digital divides when they occur. A couple of the programs in the broadband section of the Infrastructure Investment and Jobs Act are the Affordable Connectivity Program, which you might have heard about. It provides $30 a month for low-income households towards their broadband bill, which is that affordability piece that we talked about. There's also the Broadband Equity Access and Deployment Program. This is a $42.5 billion program aimed at getting access to unserved and underserved areas across the country. There's the Digital Equity Act, which I'll talk more about in a moment, the Tribal Connectivity Program, and then there's also a section there that asks the FCC to create some rules around digital discrimination to make sure that internet service providers can't discriminate based on race or income. Next slide, please. So the Digital Equity Act is a program that has two programs split into 3 grants. The first program is the State Digital Equity Capacity Grant Program. That's the one that's split into 2 grants. There's first $60 million for states, territories, and tribal organizations in the District of Columbia to create digital equity plans. Once they create their plans, they'll have capacity funds or implementation awards essentially to implement those plans. Then there's also $1.25 billion set aside for a competitive grant program. So for organizations across the country to apply to the National Telecommunications and Information Administration, say they want to start a digital skills program in their community, that will be funded by that competitive grant program. Next slide, please. This is the timeline. Where we are right now is states are beginning to or have already received their funds to begin their planning process. They have a year to create those plans. And then once they create the plans, they'll turn them in and then they'll be eligible to apply for capacity awards to begin implementing those plans. And then competitive applications will open up for the competitive program in fall 2024. Next slide, please. And I do want to just highlight quickly that NTIA, which is the entity administering the funds at the U.S. Department of Commerce, is really wanting states to make sure that they link the Broadband Equity Access and Deployment Program and the Digital Equity Act very intentionally because, as they say, you can't BEAD without equity is bad. In other words, the two have to be linked because they are really one and the same. As we talked about a moment ago, if I have fiber to my house, but I can't afford it, then it's not really available to me. It's not accessible. And so it's really important to NTA that the Digital Equity Act programs and the Broadband Equity Access and Deployment programs really tie together succinctly and build upon each other. Next slide, please. And lastly, I'd just like to highlight that in the Digital Equity Act, and we're going to talk more about this later, but I think this is really where this really ties with healthcare, is that in the Digital Equity Act, the Congress lifted up that they really like states to focus on closing the digital divide for what they term covered populations. And those are typically our disadvantaged, marginalized, oppressed populations, often those that you in the healthcare field are trying to reach through telehealth or other mechanisms. And they really want to make sure that states are lifting these people up, prioritizing them, and closing the digital divide for these folks. Next slide. So lastly, I'll just thank you for having me. I look forward to question and answers. And this is the way to join our community. And I will pass the mic back to Ceci.
Thanks, Amy, for sharing that broader digital equity perspective. Now let's turn to the world of healthcare again and understand the policy landscape over the last couple of years and actually our current environment as well. So I'm glad to introduce Mei Wa Kwong, Executive Director for the Center for Connected Health Policy, which is the federally designated National Telehealth Policy Resource Center. Mei brings over 2 decades of experience in state and federal policy work. She's written numerous policy briefs and articles, crafted state legislation, and led several coalitions. And she's often consulted by state and federal lawmakers on telehealth legislation and policy. She's a graduate of George Washington University Law School. So Mei, thanks for joining us today.
Thank you, Ceci, and thank you to the Institute for inviting me to participate. I'll echo what Amy said on this very esteemed panel of specialists and the work that they do. As Ceci mentioned, I am with the Center for Connected Health Policy. It is the federally designated National Telehealth Policy Resource Center. For those who are not familiar with the work of CCHP, what that all means is we receive federal funding to provide technical assistance around telehealth policy to the nation. So we help everyone from the White House, congressional members, state policymakers, health systems, health plans, providers, different nonprofit organizations, and during the pandemic, increasingly direct assistance to patients, because as was mentioned earlier, when the pandemic hit, there was a sharp pivot towards telehealth, and a lot of patients were first introduced to telehealth, and they were probably confused as to exactly what it was and what it could do. So they had a lot of questions regarding it. Next slide, please. Before we get started, I always have to start with a couple of disclaimers. Know that any information that I provide today should not be considered legal advice. It is strictly for informational purposes. CCHP always recommends that you consult with legal counsel if you're interested in a formal legal opinion. And also, if I happen to mention a company or show a picture of a product, know that neither I nor CCHP has any type of relationship or affiliation with such a company. Next slide. So this slide here really provides you with what I call the 100,000 level overview of telehealth policy changes in response to COVID-19, both on the federal and the state level. It is very high level. There is a lot of detail missing here, but what this slide really does is provide you with the areas in which temporary changes were made in response to COVID-19. And you'll see both on the federal and the state level, there's some commonalities as to like what policies that they address. So policies such as surrounding where the patient was located, such as if there was a geographic limitation that existed or a site limitation, how the service could be delivered, what modality is used, was it via video or audio only or some other type of technological modality, and also the type of services that were covered and the type of providers that were allowed to provide the service and would get reimbursed. So those were common areas that both policymakers on the federal and state level had to address in response to COVID-19. Now, the way they went about it differed quite a bit, but again, at least they were touching upon the same issue areas. And you'll also notice that there are issue areas that were exclusively on the federal jurisdiction and some that were exclusively to the states. So on the federal side, things such as HIPAA, that was something for them to address, whereas on the state side, licensure was an issue that they addressed. And all of these things are important to keep in mind because they all impact the utilization of telehealth, what providers can do, what they're able to provide to their patients, and also what types of services the patients themselves are able to access. Next slide. So we'll go with the federal level first and just to give you an overview of what happened. When you talk about telehealth policy on the federal level, the majority of the established telehealth policy that specifically addresses telehealth is centered around the Medicare program. Really, what does Medicare cover, what they'll reimburse if the service is provided via telehealth. And that's where a lot of the focus of the federal changes happened, was what was going on with that Medicare program and what that Medicare program would cover if the service was provided via telehealth. That's not to say there weren't other federal policies that impacted telehealth. There definitely were. As I mentioned earlier, HIPAA, but also around prescribing a controlled substance, again, something that is in the jurisdiction of the federal government to control rather than on the state level, and other issues related to telehealth. But the majority or the bulk of the temporary policies put in place on the federal level dealt with Medicare. And for those who may not be as familiar, that Medicare telehealth policy, when you compare them to what was going on in the states before the pandemic, the federal policy with Medicare was actually really behind even before the pandemic. So they had a lot of changes they had to make to catch up to where some states were, but also to catch up to where it would be used most effectively in providing services when we're addressing what was happening during the pandemic. So before the pandemic, it was very limited in how you could use telehealth underneath the Medicare program. You had limitations on where the patient had to be located. They had to be located in a certain site, a certain type of building, usually a medical facility, and they had to be located in a certain type of geographic location. There was also a limitation as to like what type of providers could provide services via telehealth and get reimbursed by Medicare. And also there's a limited list of services and a limited way in which you can provide those services. So essentially before the pandemic, live video or video was the only way to provide services to patients if you expected to be reimbursed by Medicare. There was some very limited asynchronous types of services that were allowed and a couple of other types of services that didn't necessarily fall underneath the umbrella of telehealth in the view of Medicare, but essentially live video was the only modality. So you can see it was very narrow and very restrictive. And then we suddenly had this pandemic hit and it was highly infectious. So telehealth was turned to as like a tool to be used, very natural type of decision to make. But then you had all these very limited policies around what Medicare would cover. So we had Congress act because a lot of this is embedded in federal law. So Congress needed to act before CMS could do anything. And we saw an expansion of these policies to allow for greater use of telehealth. But the thing is that they're temporary policies for the most part. There have been some permanent changes made, not necessarily on the congressional level, which is the main thing, because a lot of these major changes are in federal law that would require congressional action. They haven't necessarily really addressed making some of the temporary waivers, some of the major ones, permanent. CMS has done a couple of things on their own through the regulatory process, but we're still at a point right now where a lot of the major policies are still in a temporary phase. So theoretically, when the public health emergency is over, these temporary policies will go away. What we have now and what we do know now, and I'm going to caution that telehealth policy, as we saw from the past 2 years, can change on a dime, and it can change very rapidly. So while we're talking on this particular webinar on December 7th, this is what we know what the landscape would look like if the public health emergency is declared over, at least on the federal level. The public health emergency is declared over. We have a grace period of 151 days of some of the temporary policies allowed for telehealth during the pandemic. Not all of them, just like a couple of them that we will have like temporary policies sticking around. And then there were a couple of like permanent changes made. This is still like a question mark because we're hearing rumors that there may be more changes coming through congressional action, perhaps extending things a little bit longer. But we know we're going to have a grace period about 151 days for some of these temporary policies. Next slide. The states were a little different. So each state does things differently as far as what they do with telehealth. And this is sort of like the evolution of telehealth policy on the state level. From 2020, which is a little bit before the pandemic, that's where these numbers come from, compared to 2022, you can see the changes that have been made. The most significant change here, as far as their Medicaid policies around that audio-only component. Dr. Lee mentioned earlier that some consider that underneath telehealth, but before the pandemic, a lot of jurisdictions did not. They considered it actually outside of telehealth. But because as issues that Amy brought up, due to access to connectivity, to equipment, there was a need to allow audio only to be used because certain populations would not be able to access those services. So we've seen a significant shift in policy allowing like audio only coverage to happen compared to what we had pre-pandemic. For 2022, you'll also see the sort of more popular issues of enacted bills. Medicaid and private payer, that's around reimbursement and coverage, prescribing and professional regulations was sort of the middle type of popular topics, but the most popular topic for enactment bills was around licensure. Now, these are two issues that are really important to talk about when we're talking about digital equity. Audio only, obvious element there because not everybody has access to connectivity where you can do live video or access other types of modalities. So you need audio only to still be available to ensure that certain populations are also able to access services. Licensure is also an important issue to consider, because there is going to be a shortage of professionals perhaps in certain locations and people not able to access services, but then they may be prevented from using telehealth to access the services because of the licensure issue. And that is a state jurisdiction issue as well. There's very little the federal government can do. So you have 51 different jurisdictions doing different things around licensure, but for the most part, they all require a license in order to practice. So these are all issues that still surround telehealth that impact the usage of it and also impacts patients' access to it, and could create some sort of inequity between different populations depending on how many resources they're able to apply to receiving their healthcare services. So that's sort of your quick overview of what's happened both on the federal and the state level. If the next slide is just some information on CCHP if you wish to access it, but I think that's it, and I'll hand it back over to Ceci.
Thank you, Mei. That was a really helpful and very fast. I appreciate you being so speedy in giving us the landscape of policy right now. But let's turn to our final speaker. Dr. Jorge Rodriguez is the digital health equity researcher and hospitalist in the Division of General Internal Medicine and Primary Care at Brigham and Women's Hospital and Harvard Medical School. He has been focused on ensuring digital inclusion in the development and implementation of patient portals, mobile apps, and telehealth, and he's published several articles on digital equity and public policy. He completed his internal medicine training at Massachusetts General Hospital, and he completed a clinical informatics fellowship at Beth Israel Deaconess Medical Center. So Dr. Rodriguez, thank you for joining us today.
Thank you so much, and thank you for having me, Ceci, and team, and for the rest of the crew. I also was taking lots of notes as things went through. So I'll share with you a little bit about my thoughts around how do we strive for digital health equity in the next few minutes. We can move to the next slide. Before we do that, I'm hoping you can all take this afternoon or this morning, depending on where you are, to time travel with me back to 1925. So this is an article from a futuristic magazine from 1925, where they were imagining how healthcare might be in the future. And as you see on the top left there, you see a clinical team taking care of a patient and their care partner remotely. If you then look at the middle image there, the larger image, you see all the things that you would need to make this work. You would need a robust radio signal infrastructure. You'd need to be able, that signal to get to the patient's home, get to the clinician's, wherever the clinician was. You need everyone to be able to afford it, to be able to afford the devices, everyone to be comfortable with it, to have trust in it. And you can see even in our wildest imagining of what digital health, what telehealth might look like, we saw a lot of the challenges that we all discussed today. But I think over the past 2 to 3 years, with all the changes between the pandemic-related changes to telehealth policy, in addition to the enactment of the 21st Century Cures Act, which empowered patients to have more access to their data, we have a real big opportunity here to reimagine the way we implement digital health to be focused on equity. So with that in mind, hoping in the next slide, to share with you kind of really 3 key points. 1, how this really represents an opportunity for care, some important design and navigation, some considerations, and 3, how do we talk about technology as a tool for health equity? So to start with the first one, next slide. When we talk about an opportunity for care, I always like to take a step back and remember why I went into medicine. And part of the reason I went into medicine is because I really enjoyed that connection, that relationship that I was able to build with my patients. And if you talk to patients, they equally will say part of the value I find in going to see my clinical team is that relationship, that trust that we build. And this is where digital health can help support that kind of key foundational aspect of the way we deliver care. And that's exemplified to me by a recent experience one of my colleagues had, where he was at a busy primary care clinic in the afternoon. One of his patients was slotted to come see him for diabetes management. After a few minutes, the patient had not shown up, and my colleague was really concerned about this patient. So he was able to convert that visit into an actual was a telephone visit. He was able to call the patient. The patient had actually forgotten about the visit, but they were in a place where they could actually have the visit. And so now that visit went into his management of diabetes, adjusted certain medications. And so it went from a place where we had almost a lost opportunity to really kind of converting into an opportunity for care. And I think that sort of highlights to me the importance of these tools, but also the importance of sustaining some of the work Mei Kwong had mentioned around telehealth and audio only policy. So that's a little bit about the opportunity for care. If we move to the next section, I'll really focus on design and navigation considerations. And as we talk about this, I always like to tell people, I want you to think about your favorite app. That app that you grab when you grab your phone, and you're like, I'm going to click on that app. Just think about that as I tell you about my favorite study. So if we move to the next slide. So this is a really simple study, but makes such a great point. This is from colleagues over at UCSF, Dr. Sarkar. They essentially took a series of mobile health apps to focus on chronic disease management, and they had patients in a safety net setting, so generally marginalized populations, try to complete data entry and data retrieval tasks on the apps. And if you see there, the patients were only able to complete about half the tasks. So if you think about whatever your favorite app is, let's say it's Instagram, if you were only able to post pictures, but you couldn't figure out how to look at pictures, it probably wouldn't be a very useful app to you. And I make this point to kind of highlight the fact that there's important design considerations, both in the way healthcare systems build workflows, but also in the way vendors design their tools. And as healthcare organizations, I think we have an opportunity to, in that initial interaction with a vendor, to say, what was your design process like? Who tested your tools? Are they available in different languages? And I think it's an important point that really kind of starts a lot of the interaction. That first interaction that patients have will come through that sort of initial user interface. But even if we built the perfect interface, patients might need a little bit of help, and that's where the next slide comes in. And that's where the world of digital health navigators have come into play. Now, my colleague here, Amy, in the NDIA will tell me, hey, we've been doing digital navigators outside of the healthcare system for a long time, which is true. But in healthcare, they're just now, to some extent, getting a little bit more focus. And so digital health navigator is essentially a new team member that helps and supports patient a bit more one-on-one to see how technology is going to implement into care. And to exemplify that, I'll share with you in the next slide just a brief experience that we had. So this is digital health navigation that we did at Primary Care Clinic here in Boston, Massachusetts, where I practice. The goal of this was really it came from the Health Equity Committee, actually, and they noticed that, as the slide shows there, that our patients who were Black, Hispanic, or Latinx were enrolled at lower percentages in our portal than other populations. And so we focused in, and you see there, JP in the white was our first digital health navigator, and his whole goal was to outreach to patients who were coming in for a visit and try to show them how to enroll and use the patient portal and really show them how it made an impact on their diabetes care. In the end, we thought it went pretty successfully. We were able to enroll about a third of the patients. And one of the things I don't show here is that of the patients we enrolled, most of them, like 70 or 80%, went back to the portal at least one time again. So it's not like we just enrolled them and then, they never used it again. They seemed to use it again after that one-on-one support for patients. And so one of the common questions that comes up is, wow, this is great, but how is this potentially sustainable? Like this came from grant funding here, and that's where I think of the overlap with a lot of the work that Amy and NDIA are doing. If you go to the next slide, is where this key opportunity, I think, in quite a unique time for the Infrastructure Investment and Jobs Act, because I really view that healthcare can become a more kind of clear stakeholder in the great community that the NDIA has built as another touch point. So you can imagine the patient coming into the visit, getting connected on the portal, but perhaps we've identified a patient who lacks some digital literacy. Could we then connect them to a community organization that's working to expand digital literacy in other spaces? And by working together, we sort of can create a bit more of a digitally inclusive community. And that really gets at the larger thinking around how we think of sociodeterminants of health, which Ceci has mentioned, kind of digital inclusion as a super social determinants of health here. So I think this is sort of a unique time for us to be able to collaborate. I think healthcare organizations can take a bigger role in connecting patients. And the other thing I'll mention with the Affordable Connectivity Program, another kind of great opportunity. I know in my city, Boston, we're amongst the lower end of the cities using the Affordable Connectivity Program. So a lot of key opportunity to identify patients who may lack a device, who may lack internet, and say, hey, can we connect you to this program that will really create a more sustainable impact on your digital inclusion than something like, giving the patient like a time limited, hotspot or something. Really kind of thinking towards sustainability in the long run. And as we move to the last part of this around health equity, the next slide. I really, after I just told you how great digital tools are and how we're really kind of excited about them, I really always like to check myself and say, what's the underlying issue here? What's the health disparity that I'm trying to address? And is technology the right tool for it, right? I don't want to just say, fall into the app trap and be like, oh, the next step has to be an app. I really want to take a step back and say, is technology the right tool for the job? The point was that digital health equity is really key, but only as long as it gets us to health equity. It's sort of a tough thing to say, but to some extent, I think if in the end, all of my patients with diabetes have all the fanciest technologies in the world, but their diabetes is no better, then I should really take a step and say, like, maybe technology was not the right way. And I think that's where us as healthcare system, we have that unique piece, I think, that like Dr. Lee mentioned in some of the research to kind of address, like, this digital tool really make an impact and help us just achieve our ultimate goal, which is really health equity. So with that, we can move to the next slide. And just thank you all so much for having me. And I'm always happy to chat, obviously, on the panel. And then later on, if you want to reach out. Thanks so much.
Thank you, Dr. Rodriguez. This has been a really fantastic panel of speakers, and I just want to applaud all of them for tackling really hefty content in a very short amount of time and doing their best to sort of inform all of us in a very sort of short duration of time. So we, again, received a number of questions in advance. It does feel like some of the questions that we received, for example, around designing for digital equity and patient voice, may have been touched on by Dr. Rodriguez just a few minutes ago. I do see that we do have quite a few questions around how will we measure and track our progress. So to kick us off, I'd love to ask everyone on the panel to just sort of share a little bit about your thinking about how do we measure, how do we know we are headed in the right direction for patients and for our systems, and how do we track progress? Anyone would like to start?
I can start. So we're actually about to have a lot of data from that states will be collecting through the planning process for the Digital Equity Act and the Broadband Equity Access and Deployment Act. And Congress rightly recognized that states have a really important role to play in terms of ensuring digital equity and broadband access across the country. And so they gave them a lot of responsibility through these two programs. The plans that the states have to create for both programs, the states have to create a lot of measurable objectives for achieving digital equity and looking at specific things like affordability and devices and things like that. And so the states will begin tracking progress on closing those digital divides within their individual states. And by states, I do mean states, territories, the District of Columbia, and all the tribal organizations that will receive grants. So within 5 years, we'll have a lot more data on progress made. The question about how to do that and what are the right metrics, that's really up for debate. There's not a long history of measuring success and progress in the digital equity space. With access, it's easier. Are you connected or not? And to what speed and to what technology type? But with digital equity, those things like skills are more fungible. It's harder to determine, have you checked the box? Is somebody actually digitally have all the skills they need, especially if we're putting people on, if we don't want to stop with one skill set, right? So it's a bit more difficult.
Can I just tack on to what Amy was saying in that planning process and deciding, like, how are you going to track this? How are you going to measure this? It's really important for the healthcare field to be involved in those discussions. I think sometimes just because we're in the middle of a pandemic and the healthcare field has been like exhausted for the past 2.5 years doing this. And I know in talking with them in something like around broadband, saying like, hey, have you been, involved in these broadband discussions? I get a lot of, we just can't take on one more thing. But I think it is really important for them to have a voice at that table there in discussing, like, how are you going to do these measures? What are we going to be looking at? Because they are the experts of, like, what are the important factors, the important points of data to track. So I know it's like asking them a lot after what they've just been through for the past 2+ years, but it is really important to hear that voice.
Yeah, and I just mentioned, thank you so much, Mei, and Amy, such a great response there with that. I mean, and it's such a great question because you can't monitor progress unless you track it and measure it. And so we do have to make sure that we have meaningful measures that allow us to track our progress. And, I mentioned earlier some of the studies that have been done. I think continued research in this area to really understand what are the characteristics of what's happening with respect to the digital technology that we put out there, with respect to the various things that we're interested in, the socioeconomic status, the age, the language proficiencies, and other things like that, so that we can truly, fully understand that. And then in the end, really, it does come down to what Dr. Rodriguez was talking about, health outcomes. Digital equity translating to health equity, and making sure that that is a component that isn't left out in terms of the research that we're doing, so that we can make that connection in terms of what we're really trying to achieve in the end, which is health equity.
Yeah, I'll just say, I think I agree with that. I think I often think about it in like the, quintuple aim of medicine, just kind of at a very high level. Are we improving patient experience? Are we having better outcomes? Are we having lower costs? Are we improving clinician well-being? Are we achieving health equity? And those are very obviously very high level things, the devil's in the details to some extent. But I think that's sort of what I kind of think about, at least on the healthcare system side, when I kind of try to arrange this all.
Great. And in addition to being involved in a sort of a proactive way in conversations around broadband accessibility, do you have other advice for health systems or policymakers?
I'll start us off. I mean, one thing that looking at the policies that are out there, at least what's been done so far, that I see as lacking at this point was an important point that Amy touched upon, and that's that digital literacy side of things. There's been a lot of investment, obviously, in broadband, and that's very important, building out that infrastructure. But as Amy said, like, you may have the infrastructure, but if you can't access it because of lack of fundings, or really even the lack of knowledge of how to use like the equipment or how to access it, it's not going to be useful to you. I think, Dr. Rodriguez, in listening to his presentation, he was talking about how helpful it was to have that health navigator. So that education component is going to be something that's going to be vital. And I'm not seeing as much investment. There's talk about it, but there's not as much investment as far as on the policy end in making sure that that's also something that's paid attention to and shored up. Yes, there's been a lot of investment in infrastructure, which is needed, and it's great, but let's not forget there's like other components to make this all successful that's going to be needed, and that's that digital literacy and that education side of things.
Yeah, to May's point, the Digital Equity Act is $2.75 billion, and that is intended to partially address, right, this digital skills gap, among many other things like affordability, computers nationwide and throughout the territories. And then, but the BEAD program, or the deployment program, was $42.5 billion. So 2.75 we are extremely grateful for, but it's not going to be enough, right? Like, there needs to be more investment in that digital skills and all those other things that help people get online. And a couple of things I'd just highlight that I'd love to see healthcare systems do is I'd double down on May's point. Please get involved in the state digital equity and BEAD planning processes. The states need you, they need your voices, and they need to hear from you about what you're seeing on the ground and what you're seeing when you're talking to patients. Like, all the things that Dr. Rodriguez and Dr. Lee were talking about are really vital pieces of information for them to know. And then also, in many states across the country, there are digital inclusion coalitions, and there are groups of folks working in digital inclusion in communities, and they also need you. I know you're strapped for time and you're burnt out, but this is definitely a place where your voice is needed.
Thank you.
Yeah, and I think it's a cultural shift, a mindset shift that needs to happen within the health systems as well, to understand that, hey, just because I have access to a certain piece of technology, just because we have a digital way of doing something, doesn't mean all our patients have the ability to access that or have the understanding to be able to access that. And then to use every opportunity, every touch point to say, are our patients able to benefit from this type of technology that we have, just as sort of that there should be in the back of our heads every time, are there transportation, food and security issues, housing security, like you mentioned earlier, this super determinant of health. are there technology barriers that will prevent the patient from getting the full benefit of what we have to offer to them? And then so using, say, in-person opportunities where a patient is in person with me to try to help with some of that training, to try to make sure that they've got that technology available so that in the future, they can take advantage of the benefits of what we're having to offer in the digital method.
Thank you.
Go
ahead, Dr.
I was only gonna say that I think as from a healthcare system perspective, I think we have a lot to learn and could benefit from learning for folks in the community, NDIA, who've been working on this for a long time outside the healthcare system. And I think it's an important place to, especially from the digital literacy side, to say like, hey, like, how have you all done this? Because I don't want to see us like reinvent the wheel. Like, how do we, like when we were doing the Navigator project, we used a lot of the resources to figure it out. So I think there's a big opportunity to learn outside of the healthcare system and try to bring it in.
Great, thank you. And we are almost at time. So before we close out, I'd just like to ask each of you to share what you think is a really key takeaway that you'd like our audience to leave with today.
I'll start. I think the big takeaway for me that I always, as I said at the end of my talk, is really kind of questioning myself. Is technology the right tool here, right? If really our goal in health equity is driven by social determinants of health, if we look at whatever the social determinant of health is, or whatever the health issue is, the health disparity is technology the right tool? And making sure that we're able to answer that question clearly before we go like, oh, I'm going to go like invest in whatever technology. And because that's investments that could be made in other areas of a patient's life, patient's care, that could kind of go a longer way.
Yeah, mine is that.
Oh, go ahead, Dr. Lee.
Sorry about that. Yeah, mine is that this obviously is a very complex topic, and it's a multifaceted approach that we need to take to be able to tackle this issue here, from policymakers to technology companies to physicians, to provide input to all of these things here, and focus on this challenge and forums like this that get the attention out to others to be thinking about this, and then working together and collaborating, and then figure out what the best solutions are, is my takeaway.
Thank you, Dr. Lee.
So I'm focused on telehealth policy, so I'll stick to that. And that's just, as I mentioned earlier, it's in flux. So that means not everything is set in stone yet. So to reiterate what we were talking about a few minutes ago, get involved then to make sure your voice is heard in like helping to shape that policy, because there's still an opportunity to shape some of it. And even what we've noticed with like the state legislation, things that the states decided a year ago, they came back and tinkered with it in this current year. So even if they pass a bill and say like, okay, that's going to be our permanent policy, there's probably still an opportunity to make some adjustments to it. So it's really important to hear your voice in those discussions in order to do what we all want, which is to have the best policy available out there for patients.
Thank you.
I agree with what everyone else has said, and also just another plea to get involved in the state planning process. The NTIA on their website, broadbandusa.gov, have the list of contacts for each of the states that are leading these planning processes, and you can contact them there. And then also, again, work with your coalitions or local communities. This is about building ecosystems for the future and systems of change. And so really the more we work together and collaborate, as all the others have talked about, the better it will be for everyone.
Great. Well, I want to extend a huge thank you to all of our panelists for sharing your perspectives and deep knowledge, as well as sort of the resources that have been listed here today. And for our audience members, we'll be posting a recording of today's session on our website in about a week. And we will make the PowerPoint slides available as well. So I want to thank all of you for joining us today and for giving us so many excellent questions. We hope you leave today's conversation with new information and ideas about ways that we can all contribute to a more equitable future by advancing digital equity. Thank you. Have a good rest of your week.